I have a panel led by Minister Thulas Nxesi, also the Deputy Minister, Ms. Pinky Moloi, and the Director General of the Employment and Labour, Ms. Tobile Lamati. They are also going to be supported by representatives from the Compensation Fund, UIF, who will be assisting with the questions. How the media briefing will proceed henceforth, the Minister will give an input, and thereafter the Inspector General, Mr. Tibo, will also come in and give an input, and also the Deputy Minister, Ms. Pinky Moloi, will also give an input. And thereafter, we will take questions from the team that I've already mentioned. And Minister, you would have to come to the podium to be able to give your input, and it's over to you, Minister.
Thank you very much, Ms. Williams, Acting DG of the GCIS. The Deputy Minister, the DG, the senior management of the department and members of the media. My main task today is to provide information on the preparations for the move to stage 4 of the lockdown and the partial return to the workplace tomorrow. This is the focus of today. However, the Deputy Minister will also provide additional information regarding the department's other services. Government has said that easing of the lockdown will be carefully phased, or a carefully phased process based on the risk assessment and the necessary levels of preparation. Therefore, in returning to work, it cannot be business as usual. With this in mind, as Minister of Employment and Labour, I issued a direction in terms of Regulation 10, subsection 8 of the regulations issued by the Minister of Cooperative Governance and Traditional Affairs in terms of Section 27, subsection 2 of the Disaster Management Act 2002. That's Act number 57 of 2002. The direction sets out the measures that employers are required to take to prevent the transmission of COVID-19 in workplaces. And these, we must emphasize, are minimum measures. Employers can be able to go beyond that. The department is working closely with the Department of Health in creating an environment to support the employers in combating the disease. It should also be flagged that the Inspectorate conducts inspections at all workplaces, including healthcare facilities, in terms of the regulations for hazardous biological agents to ensure safe and hygienic conditions. The direction seeks to ensure that measures taken by the employers under the Occupational Health and Safety Act are consistent with the overall national strategies and policies to minimize the spread of COVID-19. The direction reflects all that we have learned about the virus and how to combat it over the period of the lockdown and from international best practice. The direction contains the basic measures that employers, by basic measures we mean the minimum, that employers must take to prevent the transmission of the coronavirus in the workplace. Businesses that are reopening must put these measures in place before restarting the work. I want to emphasize this, that the businesses that are reopening must put the measures in place before restarting the work. They know themselves in terms of the regulations, in terms of the guidelines which were issued by the Minister of COCTA and Minister of DTIC. They are very clear which are those sectors. I think it's in Annexure E. Annexure E, it's very clear which are those sectors in terms of that gazette. A risk assessment or risk assessment review must be undertaken to adapt the provisions of the direction to the specific requirements of the individual workplaces. The direction in no way reduces the existing obligations on employers in terms of the Occupational Health and Safety Act of 1993. The direction is based on infection transmission prevention and specific occupational hygiene practices that focus on the need for employers to implement measures to mitigate or eliminate the transmission of the virus in the workplace. Employers must take measures to protect the health and safety of everyone in their workplace. This includes employees of contractors, self-employed persons, and volunteers. The process starts with a risk assessment in the workplace and a clear plan to implement the measures contained in the direction. Every employer must do the following: notify workers of the contents of the direction and how it will be implemented. They must inform employees that if they have COVID-19 symptoms, they must not be at work and grant paid sick leave or apply for COVID-19 TERS benefits. The employer must appoint a manager from within the existing structure to address the concerns of the employees and workplace representatives. This must take measures, or they must take measures, to minimize contact between the workers and the public to prevent the transmission. They must minimize the number of the workers in the workplace at any time through shift or working arrangements to achieve social distancing. The employer must provide employees with information concerning COVID-19 and how to prevent its transmission. They must report any diagnosis of COVID-19 at work to the Department of Health and the Department of Employment and Labor, investigate the cause, and take appropriate measures. It is a contravention not to do so as an employer. They must support any contact tracing measures initiated by the Department of Health. With regard to social distancing, workplaces must be arranged to ensure a minimum of 1.5 meters between workers. If this is not practicable, physical barriers must be erected and workers must be supplied free of charge with the appropriate personal protective equipment, the PPEs. Social distancing must be implemented in all common areas in and around the workplace to prevent crowding, including working spaces, canteens, meeting rooms, etc. In relation to screening, employers must screen workers for symptoms of COVID-19 at the time that they report for work, namely fever, cough, sore throat, redness of eyes or shortness of breath or difficulty in breathing, body aches, loss of smell or loss of taste, nausea, vomiting, diarrhea, fatigue, and weakness or tiredness. workers should immediately inform the employer if they experience any symptoms whilst at work. Not doing so is a contravention of the Occupational Health and Safety Act by the worker. More importantly, the worker put themselves and their own co-workers at risk. So you can see we're talking about responsibilities and obligations from both sides of the employer and the employee. Workers with symptoms must be placed in isolation and arrangements made for their safety or for their safe transport for a medical examination or for self-isolation. Shops and other workplaces to which the public have access must screen all persons entering the workplace for symptoms. Employees who recover from COVID-19 may return to work after the medical evaluation and subject to ongoing monitoring in line with the instructions of the department. It can't be COVID. It's COVID. It's COVID. It can't. COVID-19. So in line with the instructions of the Department of Health. In relation to sanitizers and disinfectants, employers must do the following. Provide sufficient quantities of hand sanitizer with at least 70% alcohol content. Ensure that work surfaces, equipment, and common areas such as toilets, door handles, and shared equipment are regularly cleaned and disinfected, and they also provide adequate facilities for hand washing with soap and clean water and sufficient paper towels. On masks, workers must wear masks at work. Employers must require members of the public entering the workplace to wear masks. Employers must provide each employee free of charge with at least 2 cloth masks to wear whilst at work or commuting. They must be suitable for washing and drying masks. Ultimately, the employer remains responsible for maintenance and upkeep of the PPEs. Where risk assessment indicates workers must be provided with alternative appropriate PPEs, e.g. the N95 or the N97 masks, to provide a greater level of protection. Every workplace must be well ventilated to reduce the viral load. In relation to personal protective equipment, employers must keep to date the recommendations from the agencies, such as the National Institute for Communicable Diseases and the National Institute for Occupational Health, on the appropriate steps to take to prevent transmission in their workplaces and for the provisions of the PPEs. In relation to enforcement, labor inspectors are empowered to promote and monitor and enforce the compliance with the direction. Any employer who does not comply with the direction may be ordered to close business. In addition, as the failure to comply fully with the OHSA, the Occupational Health and Safety Act, it's a criminal offense. Failure to take necessary measures to prevent the transmission of COVID-19 may result in the criminal prosecution. Investigation and enforcement services. Those are the regulations, but I need to update you on the state of readiness and the inspection and enforcement of the regulations. The labor inspectors have carried out some 2,226 inspections during the lockdown. These include public sector premises and 86 health facilities. The rate of compliance by the employers has increased from 50% to 60% over the period of the lockdown. The inspectors inform me that the basic hygiene measures and PPEs are increasingly evident in most of the workplaces. Where this was not the case, on average of 9 prohibition orders were issued per day, leading to the total or partial shutdown. Currently, there are 170 inspectors in the field out of the 200, and I need to mention that this includes highly experienced, qualified inspectors used to working with the hazardous material. In 2019 budget, provision was made to employ additional 500 inspectors. The process is now being expedited to meet the demands of the pandemic. The department is looking at using accredited, registered inspection bodies to increase its reach. It would be impossible to inspect every one of the 1.8 million businesses. Therefore, inspectors rely on the support of the individual workers, the unions, and socially responsible employers in providing vital information, which in turn allows the inspectors to focus on the hotspots and to make example of a particular offender or particular offenders. In turn, this leads to great self-regulation and compliance. And I need to make the point that whilst we depend on the goodwill of the responsible employers, workers, and also have a responsibility here. They have to wash or sanitize their hands, to wear the PPEs provided, to keep their workstations clean, and to follow directives in relation to health and safety. This is in everyone's interest, that everyone remains safe and we curb the spread of the coronavirus. We need to also stress the role of the stakeholders in the workplace. The safety reps and the health and safety committees, which have come into their own during the present pandemic. It is vital that we get the buy-in from the workers in the implementation of this direction, and we draw on the expertise that exists on the shop floor. That is why the unions are so important. In addition, at the national level, at NETLEC, we're discussing the framework to allow the union leadership to move around to address disputes in individual workplaces. It's important that we acknowledge the role of the social partners in NETLEC in the development of this direction. We are also mindful that the direction imposes a number of additional burdens upon the employers, and we will monitor this situation very closely. But thus far, we have been cooperating with the employers, with the unions, and the community organizations at NETLEC. The COVID-19 crisis has highlighted a number of gaps in our social provision in relation to the UIF. There are important groups that are not covered: informal sector, non-standard and freelance workers. These issues have been raised by the International Labour Organization, the ILO, in relation to the future of work, where a growing number of persons do not fit into the traditional employer-employee relationship. This matter is firmly on the agenda of the department. At this point, the responsibility remains within the realm of social development and President's undertaking to expand the social security safety net. And thank you. Let me hand over to the Chief Inspector. The Chief Inspector who will address the development of the sector guidelines and the technical aspects of the direction. Thank you, Ms. Williams.
Good afternoon. Thank you, Minister, Deputy Minister and DG. I think, Minister, you've covered quite a lot of the issues very well that needs to be complied with. I think one of the important things is that COVID is no longer new. The disease is now well established and it's known to us, and there's been a proliferation of information. I think one of the things that we have to be careful of is us subjecting ourselves, obviously, to fake information, and also information about where exactly does a disease come from. Those are things that should be behind us and affects those people, obviously, at a different level. But you as an employer and the employees, how does this impact on you in relation to the workplace? As indicated, over the last, since the guidelines came out mid-March, we have had quite a bit of interaction with various role players and employers and the workers out there in developing some of the documents. All our role players were involved. So it's not as if this is foreign or the documentation that we are producing is foreign to anyone. When you look at the information then that is out there, and the Minister touched on it, the issues around that reside under administrative measures, issues such as social distancing. By now we are fully aware, those of us that were not at work, but we have visited workplaces such as retail stores and so on, and we have seen how employers have introduced this into the workplaces. The employers, on the other hand, as indicated by the Minister, have a responsibility to go into their workplaces and thoroughly clean up those workplaces. The workplaces have been standing for some time, and by having dust that is currently at the workplace stay there, and then having the workers interact with their workplaces is going to create a problem in that this virus is then going to go and settle on those things that will then, at some stage, when cleaning does take place, it will then enter the atmosphere and become a problem for us. So social distancing, what is social distancing? We've heard, and there has been indication that we have to have anything from 1 meter to 2 meters distance between us. And the Minister echoed what you'll see in a lot of documents that we are currently publishing between us and the Department of Health, that we have settled on 1.5 meters as the distance that we require between the various parties. Now, when there was a discussion early on by the Minister around risk assessments, you cannot have changes at your workplace without having your risk assessment being reviewed. And if you do not have risk assessments, there is a need for you, obviously, to consider that. And you'll see in the direction, there's reference to the risk assessment there. And where it talks about small businesses, you'll see that at the end of that particular section, it refers to risk assessments obviously being done, and reviewing this risk assessment will become quite crucial. Now, this risk assessment, for example, when it says that you cannot maintain the distance between you and the other party, it becomes crucial that you look at other measures that can be taken in order to ensure that the protection of those that may be affected by those around them is obviously becomes a paramount issue. So you cannot maintain the distance. You might then be required to put a barrier between you and the next person. That barrier could be a clear plastic sheet, or it could be a piece of perspex that is sufficient for you to be able to protect yourself and those around you. In addition to that, you may decide on, and this is what your risk assessment might tell you, that you may also need to have the respirator. We've also spoken about masks also in play. But of course, it will depend on the nature of the environment. Now, I'll talk in a moment to the sectoral guidelines, but your sectoral guidelines in terms of Part 32 or Clause 32 of this direction will in fact tell you that we will be issuing something that will be sector related and very specific. For example, in the retail and wholesale sector that we have done many inspections at, we will definitely be publishing something around that. Now, the issue that that was touched on, that two material masks be issued, we will have an opportunity to make a comment on that in the sectoral guideline, and maybe in certain environments we might determine that more of these masks might have to be issued, and any other maintenance requirements that may be required, we'll obviously comment on that. Just a quick one on sanitizers and disinfectants. We talk about sanitizing our hands. We don't talk about disinfecting our hands. We also don't talk about sanitizing workplaces. These are two different processes. So when we talk about sanitizing our hands, you've heard comments around 60% is sufficient, 70% is sufficient. We are saying that 70% is the way that we are going, and we'd like to see that that 70% is in fact adhered to. Now, what is the difference? Certain types of alcohols are not going to be sufficient. You could take 60% of a type of alcohol that will not give you the same effect as 70% of another type of alcohol. So we are establishing a base for you to follow, and that is the 70% that we're looking at. Another important thing, so we sanitize our hands and we disinfect our workplaces and our working environment. I'd like to also caution you around the use of sanitizers. These sanitizers contain alcohol, they are flammable. When you store them, make sure that you store them in the appropriate environment as is required by the Occupational Health and Safety Act. The use of alcohol-based sanitizers versus those that are ammonia-based, you'll see that we require you to ensure that you don't mix these substances together. Very interestingly, yesterday, my wife and I went to the shops, and she had her hands sanitized in the one place. We went to another shop, and they were using an alcohol-based sanitizer there. Later on, when we went home, she had discovered that she had developed quite an itch on her hands in relation to the sanitizers that were being applied. When you apply these alcohol sanitizers, also be aware that you would need to moisturize your hands, as you could find that your hands are drying out. So those are some of the things that I need you to be mindful of in relation to this. Cloth masks, I just want to revisit that issue quickly. The cloth masks that are out there, there is no standard that relates to those cloth masks. We have, however, been in touch with various sister departments on this, and the DTI has in fact come out with a standard, but it's a standard that we need to look at how we're going to take that forward in terms of recognizing it. But for now, we need you to be mindful that you can use the cloth mask in certain environments, but not necessarily in all environments. Your risk assessment will tell you what type of environment you'll require certain PPE in. So an N95, for example, while we are saying this is good enough for healthcare workers, and we need to be able to ensure that they can get hold of these respirators and so on, what we need to understand is if your work environment requires you to have protection at a certain level, your employer is required to ensure that they supply you with the correct PPE in order to do the work that you're doing. What was touched on earlier on is ventilation. I need you to understand something. A closed system where your ventilation basically recirculates the air could become problematic. There was a case not too long ago. I didn't touch my eye for those who are wondering. There was a case not too long ago in a restaurant where people were sitting close to an air conditioner. This air conditioner then circulated the virus to two various parties that were sitting close by, and they contracted it like that because someone close by had in fact been tested positive or was positive in relation to the virus rather. So ventilation, then open systems, obviously more appropriate. A ventilation system then that is not cleaned regularly in line with manufacturer specs or in relation to the virus, you might be sitting with a time bomb in terms of this virus creating a problem within the actual system itself, where you'll get contamination and you'll be contaminating various places within your work environment as well as people. Other PPE has been elaborated on by both myself and the Minister in terms of the regulations and the Act, and more specifically the hazardous biological agents. Make sure that you stick to what is required in terms of the hazardous biological agent regulations. The other issue that I would like to quickly emphasize is your health and safety representatives. They are quite an important feature at your workplace. They are not a nice to have. In terms of the Act, it's a requirement, and then also your committees. At this particular stage, your health and safety committees, in terms of their duties and responsibilities in terms of Section 20 of the Act, places it clearly on their shoulders in terms of the approach they must take together with the employer when looking at health and safety at the workplace, but more so with regard to what we are currently faced with regard to COVID-19 or the disease, if you like. So health and safety committees, it was quite a surprise the other day when we were talking about this in an open forum, that it's almost an afterthought that health and safety committees need to be involved in this disease and combating it. And that is just mind-blowing at this day and age, in this day and age, given that our Act is now 100 years old. And if you take the occupational health and hygiene side, it really took off in the 18th century or the 1700s, mid-1700s, when Dr. Ramazini touched on this aspect. So we shouldn't be struggling. Where we are at the moment, there is sufficient information available for us to be able to do the work that we need to do. And employers are going to be taken to task. They are required to have minutes of their meetings at least once every 3 months. And this is an area that the inspectors will look at and focus on when they go to your workplace. Health and safety committees, representatives, they need to get the support that they require, both from the employer as well as from the workers themselves. Going on then to touch on the sectoral guidelines. Before I touch on that, just a quick one, a question that pops up that is dealt with in the direction. There's one particular clause that talks to a manager that is there to deal with issues at the workplace in relation to COVID. That is not a new person. That is an existing person that you must now basically appoint, if you like, to be able to be this go-between between the floor and obviously the business itself. Quickly then on the sectoral guidelines, there is a framework at the back of the direction. There are 6 points that the sectoral guideline talks to. Talks to risk assessments, the engineering controls, administrative controls, the health and safety work practices, and personal protective equipment. The last point, which we'll have to work on with the Department of Transport, deals with transport and commuting, and you'll know that there's been a lot of discussion around this matter. Our work, strictly speaking, is not around transport. However, we do have a role to play in terms of workers that are being transported in relation to this disease. So risk assessments, key, critical, and you will develop a plan after you have done a proper analysis. A proper risk assessment is not done by an individual. It's done by a group of experts at the workplace or people who understand their work environments, and they deal with that. The engineering controls then are those things that assist you as an employer to reduce the impact on your workforce without the workforce being directly affected. In other words, your workers don't need to have PPE necessarily. Let me give you an example of this. Your air conditioning system that we spoke about early on. It could be a physical partition that I touched on early on. And that is something that will create the sort of environment where the worker can work before you resort to them carrying PPE. However, that said, it doesn't mean that if the environment requires it, that they are also going to wear PPE. Administrative controls, that is your changes in policies and procedures and so on. You are now going to introduce sanitizers into the workplace. It's not new that you're supposed to have hand soap and paper toweling and water, running water available to your staff. That's there. It's been there. You now have to make sure that in the current environment that the workers are in fact using it, and make sure that this is available for them. So changes in policies, for example, air travel is not an option at this moment in time, be it short or long distance. People that fall sick or become ill at the workplace as a result of COVID, there are now new procedures that have been put in place, or reviewed and revised procedures that now play itself out. Health and safety work practices, these are things that are an extension of the administrative controls, and will include things like, for example, have bins that people don't need to touch on, bins that will open and allow them to dispense things. In other words, you want people to touch as little things as possible in a communal environment, and that becomes quite crucial. The personal protective equipment then, part of the sectoral guideline that we're talking about, is not your first resort. However, in the environment that we find ourselves in learning about COVID, it is better to err on the side of caution and protect your workers, because as we find one worker being infected, and we had a workplace the other day from 102, there are now 60 workers infected at that workplace, which means in essence, you've closed your own workplace. Because if we come to a place as inspectors that have workers that have tested positive, and it's a substantial amount, then we'll most likely look at how we are going to go forward with that employer. We had another employer in another province who had 30 out of 30 plus workers, 30 to 50 workers who were infected with COVID out of 300 workers. You do the maths, it will be a very short time before all those workers are infected and the workplace comes to a halt. If you look at the symptoms, if you've looked at how people are infected and the different ages that become infected, it should be clear to you that we are sitting with a problem in our workplaces in relation to this disease. These guidelines then, you'll see that probably the last passage on the guideline before you get to the annexure says that we'll be developing these in conjunction with NEDLAG as well as the Advisory Council for Occupational Health and Safety. We are available as the inspectors to assist you before you pick up problems, but we are still finding employers that we get to where there's absolutely no knowledge whatsoever around this, and we close the employers down until they're able to fulfill their obligations in terms of this disease. I think other than that, Minister, we have had good responses from some employers. Employers are proactive in a number of instances, and we look forward to working with them. Thank you very much. Thank you, DG.
Thank you very much, Inspector. Thank you very much. At this point, would like to invite the Deputy Minister, Pinky Moloi, to come and give her input.
Thank you so much, Mayor, our Program Director, Mayor Pumla Williams, Minister, DG, to our leadership, senior managers of our Department of Employment and Labor, and to all the various media houses that are here present today. I'm going to be very brief in my presentation. I think it's a follow-up briefing on the UIF. I think one of our major tasks as the Department of Employment and Labor during the lockdown has been to repurpose the UIF, our Unemployment Insurance Fund, to facilitate the flow of benefit payments to mitigate the effects of layoffs. And the introduction of the COVID-19 terrorist benefit scheme and the attendant massive increase in claims required that we completely redesign the architecture and supporting systems of the UIF claims processes. Among others, but not limited to, shifting from individual working claims like we normally used to do in our labor centers, to mass distribution hubs through online applications supported by the call centers for inquiries. And I'm sure you are all abreast and aware of our call center toll-free number 08000 3007. I'm sure you are all aware about that number. And it's very much inundated with many calls currently. So this required engagement with the social partners, labor and business in particular at NETLEC, and signing memoranda of agreements with all the employers and bargaining councils. And this, ladies and gentlemen, meant the delays at the initial phases of the process, which are still reflected in some sectors of our media. I'm sure even today you are aware of whatever it's written today about the delays that have been there. But I can now report the following progress. That there has been bulk disbursements of COVID-19 terrorist benefits of 5.3 billion rands through bargaining councils and employers, reaching 98,000 employers and 1.1 million workers. A further 2.4 billion in COVID terrorist benefits has been cleared for payment as of tomorrow, Monday, the 4th of May, to 29,000 employers. And 29,000 employers will actually translate to 462,000 employees who will be benefiting from tomorrow's disbursement of 2.4 billion. So there are still a number of outstanding claims which are still to be processed from 74,000 employers representing 481,000 workers, and an amount of 1.9 billion in benefits. So you will be happy to know that SARS has already validated 87% of these claims, and this shall be paid in the coming week. So SARS is part of us. If you are not aware, you should know now. And let me emphasize this point, ladies and gentlemen, that it will not have been possible for us to shift from the system of mass distribution hub without the active support and participation of business through NETLEC. Those who are participating in NETLEC wouldn't have been where we are today if they had not actually participated. And we need to also overemphasize the fact that even though we are having these massive disbursements through employers, ordinary UIF claims have also continued uninterrupted during this lockdown, with some 1 billion rand disbursed to 65,000 claimants. So those who have actually claimed before the lockdown, before COVID-19, have continued to receive their claims. So remember also that each recipient is probably supporting a family or a number of actually dependents, which greatly, if you calculate and do your maths, I think we are supporting quite a number through our payments of UIF claims and benefits. So to give assurance also that despite this large disbursement, the fund is also able to meet its obligations because we have 13.8 billion of investment that has been freed up to strengthen the liquidity of the fund, if should that question arise. But we have freed up 13.8 billion of investment. So in addition, ladies and gentlemen, to the system assistance, we have already received from SARS and the private sector, the company which is called Interfile, has also offered to run the UIF's SMS service at no extra cost to us. So there shouldn't be any question about how much we are paying them. They are doing it for free on our behalf. And this is an important part of our service, particularly to those who are working in isolated environments, such as domestic workers, and I'm sure you are aware also, those also who are in farmlands, or farm workers who are not necessarily able to use our email systems or online services. So this SMS system will actually help us a great deal. So there are challenges which are still there, and particularly where employers are not necessarily assisting their employees to do the claims. We are actually overemphasizing, encouraging employers to come forth to help their employees. Actually, it's much better, much more manageable if they do it en masse as employers on behalf of their employees. But still, individual employees are also allowed to submit their own claims. But it will be more, massively more actually, when we do it en masse through employers. In short, ladies and gentlemen, the compensation fund, in response to the declaration of a pandemic, has established its crisis management committee and developed a COVID-19 response plan to focus on COVID services, your compensation for occupational injuries and diseases. So in terms also of medical benefits, rehabilitation, and accounts payable. So there is also a dedicated national and provincial response teams which has been established, comprising medical professionals and claim processors to manage the COVID-19 claims. So like the UIF, the compensation fund has also opted for online applications backed by a call center for the protection of claimants and the staff, and to streamline processing and payment. So we are protecting one another from meeting at a common place. So I must also indicate the fact that few claims have been registered so far for COVID-19 with regard to COID. So this will change as COVID-19 contracted in the workplace will be compensated as an occupational disease. I think we will agree with us that there will be an upsurge once there are more claims of those who have contracted the disease. There will be more claims coming forth, but for now we have received fewer cases and claims, and that has been dealt with successfully by the compensation fund. In conclusion, Minister, ladies and gentlemen, we do have supported employment enterprises, our SEEs. As the Department of Employment and Labour, we've got 13 factories across the country. That employs 1,250 people with special disabilities. I think they call them intellectually challenged, that are actively participating in COVID-19. And these factories manufacture PPEs such as masks and gowns, which are used by our occupational health and safety inspectors. They manufacture and supply hospital linens, gowns, blankets, surgical dresses for doctors and nurses for the Western Cape province, the Eastern Cape with regards to Nelson Mandela Hospital. We are actually procuring for such, producing for those as stipulated. And the factories, our factories as social enterprises, we are currently repositioning them with SMMEs and cooperatives to play an increased role in the supply of COVID-19 PPEs, and will be approaching the various provincial governments and municipalities for consideration in their set-aside procurement for PPEs and hospital linen and other requirements. Ladies and gentlemen, thank you so much for your audience.
Thank you very much, DM. At this point, we are going to be taking questions. I don't know, the telephone, are there any callers?
We don't have callers at the moment.
Okay, thank you. Do we have WhatsApp questions, Ms. Mhlauli?
Yes, DG, we do.
Thank you. Can you proceed?
Our first question is from Thomas at Opera News Hub, and the question relates to domestic workers, housekeepers, gardeners, and construction workers. Do they have to report to work, as majority of them are currently confused as to whether they should be going back to work tomorrow? The next question is from Bernadette Wicks at The Citizen. The first question is, the vast majority of South Africans estimated 1 million domestic workers are not registered with the UIF Commissioner's Office, and as a result, they are not eligible for the TERS benefit. Is the department considering a call by civil society to compel all employers to pay domestic worker wages regardless of their UIF registration status? A follow-up question from the same journalist is, business resuming their operations now are coming off a 5 weeks downtime, and the cost of putting in place the required OHS measures are also going to place additional pressure on their profit margins. Are there any plans in place to mitigate against price hikes that would untimely see customers having to bear the brunt? And from the other side, are there any plans in place to protect these businesses which may have no other option available to them other than hiking prices in this period? Then we have a question from Lamez Omarji from Fin24. Can the Minister provide clarity on whether foreigners who are in the country legally and are legally employed, will they receive the same UIF payments as South Africans?
Is that it? Thank you. Okay, can we take that caller? If Minister is happy with that.
Hello?
Yes, we are listening.
Yes, this is Mercedes Basen from SABC. To the Minister and the Deputy Minister, I just want, there are a few questions that I want to raise. There's one around the security officers I met recently, on the first day of level 4 lockdown. And they don't have sanitizers. They told me that, I asked them, why don't you have sanitizers here on site where you are working? Because you're working with a lot of people. You check our receipts and so on. And they say they are using the sanitizers in the public toilet, and it's quite a distance. So is the employer not supposed to ensure that the security officer has sanitizers, especially in a shopping complex area in a situation like that? How are you going to monitor compliance? That's what I want to know. And then social distancing, we've heard that it's 1.5 meters, but even with police here, for example, in Parliament, they are sitting in one small cubicle at night. And the police department, we do know it's also an employer. So what is your expectation, Minister, from them, even from the department, to protect the police? Because I see them here at night, and we've seen that many police have been testing positive, over 100 and more are even testing positive. And it seems as if many of them, they get it in the line of duty. And when police are at roadblocks stopping people, they don't they need those small sanitizers in their pockets because they come into contact with many people. So that's one of the questions. I've got three more questions. What would happen to employers, especially what we've seen here in the retail stores in Cape Town, where maybe when there's a positive case in a store, the store would send the other employees, others would continue to work, and they would send them for testing, and they use the public transport, the taxi, to go and test. What if maybe those employees who are being sent to go and test, they might have the virus and they might have spread it, already in the, in the public transport. So if employers don't comply and continue to send workers to test on their own, what is it that is going to happen? And two more short questions. Those who qualify for the UIF, there are people who not lost their jobs, but their salaries have been cut for 3 months. So some of them are asking, do they qualify for, also to apply for UIF because their salaries have been cut and they are without a job for 3 months. They don't know if they will go back, but the employer says, no, you must go and sit at home for 3 months. And lastly, about the unemployment fund, I know this is a question that would have been directed to the Minister Zulu, but the banking details, one of the issues when it comes to the requirements for people to submit their details to get that 350 rand is to get banking details. We know some of the people don't even have bank cards. They don't have that. What is happening? What other route is it that they can take? Because they don't even have bread to eat. Some of them are even unemployed now. They were working and they are unemployed. So what are they going to do? Do you not think of having partnerships in that case with banks to say, even when they have to open these bank ATM cards, that they shouldn't be charged? Because for you to go and open that ATM card, you need a 50 rand, for example.
Thank you, Mercedes. I think that's enough. Minister, you'll guide who's going to respond to which one.
For the housekeepers, domestic workers, and construction workers, I have with me the Government Gazette, which was issued, which lists a number of sectors who are supposed to be going as from tomorrow, but it's partial. Under construction, it lists the civil engineering for public works projects, including water, energy, and sanitation. Public works, civil engineering, and construction work. Road and bridge projects, including local road repairs, critical maintenance and repairs. So if that construction worker belongs to this, therefore, they qualify. But we must emphasize, they must go into sites which have been properly prepared. We need a plan from the employers. We would expect that a number of the employers might spend part of this week doing what is required for them. And then the other aspects talks to the domestic workers, the households. It's here, it's listed, the private households, employment, live-in staff, and I emphasize live-in staff, and staff providing care to the sick, mentally ill, elderly, and people with disabilities and children. They have been included. So if you are a domestic worker living in, you have been covered. The issue of the cost of the PPEs, which is going to put pressure on the workers, on the companies. It's obvious that all sectors, it has happened to government. We have to go extra in dealing with this particular COVID. It was not planned by anybody. Indeed, it's going to be adding more costs to the businesses, like it has done to everybody, to government departments and so on. everybody has just, unfortunately, to go an extra mile. Now it's a question of a choice here. A choice of going extra, which is, of course, more expensive, or a choice of putting the lives of the people at risk. If you want to operate, you need to understand. You need to understand, and it's happening all over the world, that all of us will have to go an extra mile. The only plans which we are having for some of the businesses who might be struggling, it's in terms of tariffs, but we are going to be able to deal with that once we start normalizing the issues where they will have to apply, because tariffs is not just meant for the employees. If they have plans about their businesses to turn them around and they are going down, they will have to apply to the UIF, because there's a part which deals with that. The Mercedes percent, our role is very simple. We're demanding all the employers to comply, both public and private. I know in some areas, the police have been reduced for the same reason of social distancing. Instead of having 2 or 3, they are having 1. We would expect, therefore, that the department is going to be sensitive to that particular issue. Otherwise, they will be violating. Of course, it's a matter which we will also raise, because you've given us examples. And everybody must have the sanitizers. And you talked about some security who do not have sanitizers, who do not have the necessary. It means those employers are violating. As early as tomorrow now, we will get even more details from you. We are going to be sending our inspectors to that particular area you are talking about. Ezinye ndizibambanga kakuhle uDG. Sorry. Oh. It's clear what I was saying. What is expected if there are positive workers? They must be transported appropriately, transported to either to the hospitals or areas of isolation. They are not going to be, they can't just be transported in public transport. Otherwise, even those employers are violating, but we've even said to hide such employers. It therefore means you're violating, in fact, it's a criminal offense. That's what we are saying. So we expect the employers to act responsibly, to act sensitively when they are dealing with those cases. I think the issue of the public transport, I suspect it's a matter which must be raised with the Minister of Transport, but I understand even there that there is an issue of social distancing, there is an issue of the sanitizers before anyone gets into either a taxi or whatever transport, and the fact that they have to take only 70%, it is meant for that. But once they are at the work situation, they become the responsibility of the employer. Oh, yes. Thank you. I had it on my page too. The issue of the foreigners. There are those foreigners who are here legally, who have been properly documented, who are working, there has been a problem of them because of their details, and in particular the issue of the bank accounts. We have dealt with that particular matter, and I would ask after this, after the inspector, the chief inspector, that the advocate Yawa just come and explain that. But the crux of the matter is that we have interacted with the SARS, and they've given us a solution. And but advocate Yawa will talk about the numbers, because I don't carry those numbers, that those who are documented would be able to, in fact, we have found a solution of paying them. Those who are not documented, who are illegal, it's very clear that we can't do something illegal ourselves. That's very clear. Because first of all, they are not legally employed. And how will we know them? Because the employers are also covering those people. They are not claiming for those people. We don't have the records. We only find them when we do the inspections in the different workplaces. So the employers who do not comply, our inspectors, that's why we are requesting that the unions, the individual workers must also work with us and give us this information, so that we're able to use that information. We're able to visit through our inspectors those workplaces. But if they are not complying, it means they are in violation, and some are committing criminal acts. So we will have to deal them according to that. Those who have lost the jobs, sometimes even for 3 months, they do not know what's going to happen. We guess that responsible employers are going to have applied for them. If they have not applied, we've opened now the channel of dealing with the individual workers, which we're doing it electronically. We're able to do that, but we've also created the drop boxes in all our labor centers, where people come and drop their applications there, and we try and process them. So, and we had planned for a period of 3 months in terms of our calculations to be able to pay this COVID-19 TERS benefit. So we're still ready to do that. As things go on, we're doing an assessment and so on, we'll be able to say whether we could be able to increase the period beyond the 6 months. We're not sure, but we are going to rely on the calculations by our actuaries. But must remember that it doesn't mean that we would have that money forever and ever. At some stage, we might hit a crisis, and we might even be forced to reduce the benefit, depending on what is happening. Maybe the Inspector General would want to make some additions.
Thank you, Minister. I was just saying, I think the Advocate Yawa will also elaborate further on the fact that on the 2.4 billion in COVID-19 TERS benefits that we have talked about, that is cleared for payment from tomorrow, which includes 29,000 employers for approximately 462,000 employees. Actually, it includes some of those foreign nationals who are actually legal in our country. But there was also a question on whether how can we save those beneficiaries of 350 in terms of them being charged administration fee. That will. So we are in discussion with social development in terms of exploring how this how best can this work, including our public employment services with the UIF and other government databases and banks with regards to the disbursements of this 350 rands. We do have a database as the Department of Employment and Labour. So actually working together as various departments, we might actually want to engage even other sectors to say how do you either waive those administrative fees or you reduce it, but somebody else must pay for it. So we are engaging currently some of those. Minister, there was a question about compliance of some of the security guys who don't necessarily comply, who don't have sanitizers. I think if SABC or whoever is in the media, those who can submit such information or supply us with such information, because we've got an Impimpa hotline as this Department of Employment and Labour. Anybody else actually can report any such non-compliance, and we can actually act on it. We can immediately send out our inspectors to go and verify such, and where possible, law enforcement agencies can then be brought in. Thank you.
Okay, I think let's put this matter in context so that, as Deputy Minister is saying, when the 2.4 is paid tomorrow, Tuesday, and I'm a foreign national, and then I think that I'm excluded. There are various categories of employees who have not yet been paid. And the law is blind to whether you are foreign or you are a South African. It just knows you as an employee. So in the number that would have paid by now, which is over 3 million employees, there are 1.4 million employees. Some may be foreign national in that category, some are South Africans, where 50,000 applications are not yet processed because there were errors by the applications. So there may be some 1 or 2, whatever the number of national or foreign. In the number that is being sorted with SARS, cooperatively working with us, 486,000 employees are involved in that, and we give them one word. We call them the undeclared, and the undeclared or uninsured in the sense that in our insurance database as UIF, they do not appear. But we are conscious in the cooperative workings between us and SARS as government that there are some employers who pay their insurances via SARS. And this is what the Deputy Minister is saying, that working with SARS, some 87% of those have been cleared and they shall be paid in no time from now. The last category, and that may still involve foreign and South African employees, is some 12,000 where there were bank errors. We met with the Banking Association of South Africa, and by tomorrow we shall have sorted all of that. But sometimes just somebody puts a comma where it should be a full stop, or swaps the numbers, or leaves one number of the bank account. In some respects, the banks have told us that the accounts have actually been frozen. But now with the interactions that we're doing between us and them, those shall all be solved. So that pool includes employees, and some may be foreign, some may not be. And in the question that was asked, everybody gets the same pay according to the formula. There is no particular formula for this type of employees and a particular formula for that type of employees. All are equal before the law.
I think we will allow one more round, Minister, and I will start with the telephone. Are there any callers, Mr. Lance?
Not at the stage, DG.
Thank you. Ms. Mhlauli from WhatsApp?
Yes, DG, we do.
Thank you. Can you proceed?
Thank you. The first question is from Thomas from Opera News. And the question is, for those who are on internships and contracts that were set to expire during the lockdown, is there an alternative for extension of their contracts, as multiple of them didn't report to work since March 26th? The following question is from Wonga from Inkonjani FM. Has the department started paying employees who have been infected by the coronavirus in their line of duty, and how does the application process work? Follow-up question from the same individual is regarding UIF, normal UIF claims. Is it possible to apply online, or do you need to wait for the offices to open? The third question is from, the third person is Ernest Mabuza from Times Live. The question is, he'd like clarity on whether removal companies will be allowed to operate under level 4 of the lockdown in moving people from one home to another. This has been...
They didn't get the question.
Which companies?
Removal companies.
Removal.
And he goes on to say these companies are hoping for an answer soon on whether they can start operating. This is because although individuals are allowed to move from one place to another, moving companies are not allowed to by the regulations, putting the individuals who want to move in a very difficult position. And just to say that this has been a recurring question in other press briefings as well on the moving companies. The next question is from Zianda Ngobo from Newsroom Africa. Can the minister respond on whether he is concerned about certain industries shedding jobs during and post the lockdown as a result of ICT, as a result of people using ICT to operate, and what is the clarity on this? Can I continue?
Yes, thank you. Because it's the last round.
Okay. The following question is from Tebogo Monyo from Radio Riverside. Is the problem of low application numbers by employers not possibly because of the application system used by the UIF? It seems that the issue is more the tedious CSV employees files conversion and the insufficient number of people that are able to assist employers at the call center. Is the department able to look at making the application system simpler than it currently is and substantially increasing the number of staff at call centers until the majority of employers have successfully registered on the system? The same person has a follow-up question. Can the UIF TERS application process not be decentralized to at least provincial offices, if not to the regional offices, which might improve on access by employers and respond quicker to existing bottlenecks or provide quicker feedback? The following question is from Khutatso from Sant Sowetan. How will the department ensure that employers do not force employees to procure their own masks? Furthermore, what were some of the challenges on non-compliance issues that the inspectors found in the mining sector, and do they believe these would be adhered to on this time around? Would the inspectors say they are comfortable, particularly with the mining sector, to return to work tomorrow? And the last question is from Miriam Issa from Finwick. Can some Pilates and yoga studios are planning to open tomorrow while following all required safety procedures for business? Are these activities permitted under level 4 regulations? Thank you, DG.
What are those levels? I think the minister missed the last bit. Activities?
Oh, some Pilates and yoga studios are planning to reopen tomorrow, and the question is whether those are allowed under level 4 regulations.
Okay. Thank you. Radio, is there anything, because this is the last round, so that the minister can take all the questions? Okay, thank you, Minister. That's the last set of questions.
The issue of the interns, it's a big issue. It's a matter which the department is also engaging with those who are dealing with the interns, because some of them were already contracted during this, some of them it's just in the middle of this, and others were going to start. So it's going to depend. It's a matter which a department is looking into and then is going to pronounce on it very soon. It's a very difficult matter. But those who are already engaged, there's no way that we can dump them. The issue is about those who were to be engaged, what's going to happen with them. Because there's also one reality. We have to scale down on some of our activities. I would leave it to also to advocate, Deputy Minister and advocate the issue of applying online. Removal companies, I am not sure if they are in the list. That will be a matter for the Minister of Transport. I don't see them in the list, unless in the directions by Minister of Transport, something else will be said. Is the Minister concerned about some industries shedding jobs? All of us, as government leadership, and I think all political parties and the economists have put different scenarios of the impact of a retrenchment. But everybody is concerned. But also the relevant question of the impact of e-technology. It's a matter which is being discussed even by the ILO when we're talking about the future of work, when we're talking about the impact on the jobs. It is a reality that some of the workers are going to be infected as the machines are going to displace the workers, but some of those workers will have to be trained and upskilled for the future. That's why we have to take some of them and through our training program. In fact, that's a matter we're seriously discussing with the Minister of Higher Education as to how do we ramp up even the training. But it must be the relevant training, not training for the sake of training. Clearly, this revolution is going to impact on the jobs. But we will have to prepare the workers for that future. Decentralization of the UIF. I think those can be able to add, but what we know is we've said our labor centers, which are all over, there are people who are working there to help, and the DG will be able to say, we are re-looking at our strategy now. But we need to avoid that we don't open those labor centers with floods of people, and then we undermine social distancing. We end up people being infected there and even infecting the public and so on. But there is something which the DG and the team are really looking at it. But it doesn't mean that there's nobody in the labor centers. There are people where people can drop their applications. Definitely, we are talking about those labor centers as decentralized centers to deal with the matter. Well, the issue of the yoga people and so on, I don't think it's there. It's not there in the list which I was talking about. It's important that people look at the gazettes properly listed in. Let me say, give me that, Gigi. in this document, this document, the Government Gazette of the 29th of April, I think people, when they want to know as to whether they are qualifying for stage 4 to go back to work, they must go into the tables which have been put there and the annexures which are there. They are very clear about the different industries, and it will be easy to identify your industry. It's talking about agriculture, hunting, forestry, the issue of electricity, gas and water supply, in the manufacturing, construction, wholesale, information, all those which must go, which must not go back tomorrow, they have been listed. So we're requesting, therefore, the people to also look into that. I think one of the issues which is starting to come is the issue where the workers who are seeing the violations, where can they report? And I think that issue comes very strongly. And I think after the Deputy Minister has also answered some questions, the Inspector General must come back and talk about that. Because I think this question keeps on coming, but it shows the desperation of the workers. In some instances, it also shows the weakness of the trade movement in some of the areas, where the workers do not have any trade union or a shop steward to be able to help them. Because if the shop stewards were there, they would be able to help us. By the way, one of the things which we have said here, tomorrow we're coming up with clear guidelines on the trade union leadership, because there's going to be a lot of disputes. They must be able to move and help in dealing with the disputes. Same with our CCMA.
Thank you, Minister. Ladies and gentlemen, I think also, as the Minister has alluded to the fact that Advocate Yawa will also elaborate more on internships, but further to say that internships, contract extensions will depend on the agreement with various employers and the outstanding learning that must still happen, and this will also include remuneration with it. And with regards to the issue that relates to compensation fund claims, so far we have received 42 cases, and with all of them having been accepted, we have accepted liability for 41, with one outstanding, actually with one rejection. We have rejected one. It was found not to be necessarily an occupationally acquired disease, because remember, anybody who needs to claim from compensation fund, there should be a report, there should be a clinical report that indicates that we have tested positive. Therefore, all such necessary reports will be required, and we are doing a lot of verification. So you can't just say that you are sick and therefore you have contracted COVID-19 without any proof to that effect. So we have so far received 42 claims, and we have 41 has complied with all the necessary requirements. Only one was rejected. Thank you.
I will try, at the risk of appearing defensive, to tread a bit carefully, just so that we don't appear to be defensive. Maybe let's start on this point. Our leadership is talking a new normal. And part of the new normal is that instead of taking a taxi from Lusikisiki to Mthatha and back, and you spend all that money, use technology. And the technology, they have also made it easy for everyone, in that Vodacom, which is a cellular phone company in this republic, has got a contract with the department, with UIF, where people are able to access the online applications at no cost to themselves. Vodacom has absorbed that. So at the convenience of your home, our children in the lockdown are with us and they are super good because parents have invested in them. Just ask them to help you get to our website so that you can apply. And this has got beautiful results. Of the normal UIF, not the COVID-19, the normal UIF benefits, which could be unemployment, I lost a job, you apply, or you are in maternity, you apply, or you are a dependent, you apply, or there's an illness or an adoption benefit. Between the 26th of March and the 29th of April, the number of applications that we received when people would be queuing, when people would be going physically to the labor centers, has increased when they are now doing it online by 4.4%. And maybe let's give a bit of figures. When people used to queue, stand in the queue until they're irritated and so on, we would have about 62,213 applications. But when they're doing it online, no irritation, no person who treats you like you're not a human being, you just deal with the machine. On our side, we receive the application, we process. That increased from 62,213 to 65,088. And the amount paid between the 26th of March and 29th April, which is just 1 month, is 1 billion and some big money. The point we're making is that, yes, UIF is not lost and the department is not lost only on COVID-19. The ordinary life happens, and it happens through online applications. Maybe talking about the online applications, let's beg South Africans, let's beg employers, let's beg those who apply for the millions to be patient with our CSV system. There are two mechanisms with which you can lodge your application. In our online application, you can literally put each individual employee, and you can also use what we call the CSV because it takes bulk numbers. Our analysis is this, that if you were to, like the Road Freight Bargaining Council, just as an example, which is applying for 460,000 employees, if you were to put one by one employee in the online, it will really take you until you are dizzy. But now the CSV is a mechanism that converts in no time that 460,000 employees into a single file. You press go, and when it gets to our site, as our turnaround time now is 48 hours when we have done long and 12 hours when we have done fast, in no time that is paid. A good number of the employers who have been paid that 5.3 billion use the CSV without problems. Yes, there are some who do talk about this and the other, but would urge that let's all be patient with the system, it works. There was one question that was asked in the first round, that if I was paid short of my normal salary, can I apply? The answer is yes. The directive that the minister issued is saying, in fact, the very regime of COVID-19 is to protect against salary loss. And in that protection, the loss sometimes is when you got a zero. The loss sometimes is when you got something other than your normal salary. Yes, it may not pay you equal to your normal salary, but it pays something to that. And the leadership of the department, ably led by the minister, deputy minister, and the director general, some of the people who were complaining, and that payment is part of what the deputy minister was saying will be paid during this week, were that in the current UIF Act, we deduct until about 17,000. So if you earn a salary of 100,000, we only deduct 1% up to 17,000. The money above that is exempted. But now, because of the virus and the economy and everything else, everybody tended to experience salary loss. And the leadership then had said that if there is one moment where UIF must work for everybody, particularly those who contribute, it is now. And in the directives, there was an amendment to make such that anybody who did have a salary loss, whatever the salary income that you earn, must get a little bit in terms of the range that is payable. And some of the payments that are going to be made now are making this benefit truly available for every South African who works and who does contribute to the UIF. But be patient with us.